Hey everybody, happy Wednesday. Quick update for today was, everything was for the most part status quo with Luke. Everything was, really nothing crazy happened. Kind of like yesterday, which is, like Nicole said, things you wished for. We talked to the doctor today. She stopped by and just gave us an update. She had a meeting with all the other experts, her surgeons and whatnot, reviewed his case, and determined that, going down the chemo route is the right route. Pulling it now and trying to do a surgery would be really risky based off the positioning of it. And so it's definitely not something they want to do if they don't have to yet, which is, what we were expecting. When we talked to her about just the impact so far, obviously we were all hoping that it would have chemo and it would shrink, in a few days. That doesn't seem to be the case, but it also doesn't really seem like it's growing at the rate that it was, or maybe not at all. His belly's fluctuated in size, but that likely is due to fluids and gas and some of the other stuff going on, not necessarily the tumor size. They haven't done any MRIs or CT scans or anything like that to validate it. And they're not going to. But either way, it's likely going to be a longer road to getting it smaller, and there is a possibility that it doesn't shrink at all, and that isn't necessary. I mean, obviously that's less than ideal, but it doesn't mean the chemo's not working, because the tumor itself, some tumors don't shrink, and it's possible just the cells die and it's still there. So it's hard to say for sure how this tumor is going to react and what it's going to do. There's also a possibility that the doses of chemo that we gave just wasn't strong enough to get it to, start shrinking. Because they started out with a smaller dose because he's little and they didn't really know. So they took the dose that he normally would have had and cut it in half. So maybe it just stopped it growing, and then when he gets to a more fuller dose, it'll start shrinking. So ultimately, nothing about his current situation is super unexpected or, bad news. But it wasn't the best case scenario, which is it just shrunk up automatically. So really no reason to be extra concerned. She did say around the 3-month mark, they would probably have to make that's when they start talking about surgery and figuring out what the right option is, whether it's shrunk or not shrunk, and, what the long-term process is. The other advantage, obviously, of waiting for surgery is the longer we wait, the older he gets, the better it is for surgery. I guess she kind of implied that, if it doesn't grow, but he does, that in a way makes it smaller compared to him, at least. So yeah, kind of nothing unexpected, but it was encouraging to hear that, we're still moving forward. It didn't, as far as we can tell, it didn't keep growing at the rate that it was, just based off the belly measurements. So that's good news. And we'll keep monitoring it. And I want to say he has chemo next week, and it's a different chemo. And then 2 weeks after that, another chemo. I think she said, it could take up to 2 full cycles of chemo for both chemos. So a full 2 months, basically. Or, yeah. Before we would really know how effective it is, if it's really working or not. So, anyway, kind of rambling here, but overall a good day. Hope everyone else had a good day, and I'll take it. Talk to you later. Bye.